morning and welcome to the TBS eFM COVID-19 special, A Look Back and Forward. I'm your host, Na Seung-yeon. It's been a year and some months since the pandemic that swept across the world reared its head. COVID-19 has changed the way we do everything, from the way we work to the way we connect with one another. It's penetrated all aspects of our lives. Korea saw 3 major breakouts from last March when the Shincheonji religious sect first reported its cluster infections. The country has seen a few more spikes, one in the summer of 2020, but it seems like we've managed to steer clear of a major uncontrollable outbreak despite the freezing cold weather as well. Health authorities are hopeful that with vaccine rollouts underway, we will soon be able to enter into a post-COVID-19 era and go about familiarizing ourselves with untacked services and remote learning as a standard for a new normal. With the KDCA's plans to achieve herd immunity by this November, hopefully we'll be able to celebrate Christmas and ring in 2022 surrounded by our loved ones. It is Wednesday, March 31st, and you are listening to TBS eFM's COVID-19 special, A Look Back and Forward. This is on TBS eFM 101.3 in Seoul and surrounding areas. So in light of all that's taken place, we thought it'd be meaningful to have a look back at the past year through some key topics that will help us wrap our minds around everything that's happened and also examine the changes that we've seen in our lives. And to do this, we're joined by an expert panel. We'll organize our discussion around the COVID spikes that we've seen throughout the pandemic, as well as how they've impacted the healthcare system in the country. And then we'll address various aspects of the economy and then wrap up our discussion on how all things untacked have become the new normal. So that's a little summary of what we're going to do. And we're going to be back after this short break with a collection of citizens' voices on how they have fared through the pandemic over the past year.
Last year, it was just a mess.
I didn't feel like a university student.
After Daegu, the situation took a huge downturn. It was tough, and wearing masks has been difficult.
I'd say the hardest thing is just being away from family because, you worry about your family a lot and not being able to check on them, not being able to really see them.
It was a good excuse for not meeting people.
It was bleak and I became sensitive.
어두웠다고 해야 되나요? 사회 전반
It was a dark period for all of us.
침울했던 그런 한 해였던 것 같습니다.
A collection of citizens' voices, and I'm sure that we can relate to all of them. And we will try to touch upon some of the topics that we heard right there. So for this meaningful discussion, we are joined, as I said, by a panel of experts who will help us gain a deeper perspective into these key issues. Our first guest is Dr. John Linton, professor at the Department of Family Medicine at Yonsei University and also director of the International Healthcare Center at Severance Hospital. We also have the international director of the Korean Confederation of Trade Unions, Mi-kyung, and she'll be giving us some insights into how foreign workers were impacted by the pandemic. And also joining us in the studio is Bulley, senior editor of Korea JoongAng Daily. So good morning to you all and welcome to our special show.
Good morning.
Good morning.
Good morning. It's great to have you in the studio. So we do have 4 key topics that we're going to arrange our discussion around. And for each topic, Jim is going to kind of set us up with the discussion, give us a few points that we can have our discussion around. And then, of course, I'll ask our experts for their opinions along the way as well. So Jim, let's get started right away. What is the first topic that we're going to discuss?
So our first topic is COVID spikes. This is basically a timeline of what the COVID situation has been in Korea for the last more than a year. Obviously, as you mentioned earlier in the show, it starts, really the Korean story starts with the Shincheonji Church of Jesus on February 18th last year. Cases jumped over 1,700 for the first time after patient 31 turned out to be a member of the church. And by the end of February, when really COVID-19 wasn't an issue for most of the world, 2,000 cases had been confirmed and countries had started shutting their borders to Korea. That's kind of where it started. We then suddenly see Korea kind of flip it around and become this success story at controlling the virus. By mid-March, Korea's success in controlling the outbreak through credit card and phone tracking and tracing is clear. On March 13th, the number of recoveries passed the number of new patients for the first time. Cluster outbreaks continue, but that sort of initial panic is mostly over. The KCDC rolls out stricter border controls, quarantine measures. The 2-week quarantine is introduced. And that's kind of the story for the first few months. Then it isn't until May the 1st that you get what we generally consider the second spike, which starts with the Itaewon cluster.
The golden weekend.
Yeah, where a person that had been clubbing in Itaewon tests positive, and more than 1,300 people are thought to have come into contact with the person. They're told to isolate. Tracing proves very difficult, in a large part because media reports claimed that the person had been to a gay bar, which caused a backlash against Seoul's LGBT community, but also made it a lot harder to have effective tracing methods because people didn't necessarily want to say where they'd been in that area. Just a couple of months later, we get the Sarangjeil Church and the Gwanghwamun rally, which is sort of the continuation of that second spike. Over 10,000 people attended anti-government protest on August the 15th. And that's when we see social distancing guidelines really tighten. We get the infamous up to level 3, but 5 stages level system introduced. That's kind of where we stay until we reach the third wave, when cases drop in the autumn and then climb back up to the hundreds in November. They spike at the end of the year, going over 1,000, and they've never really fully dropped down since then.
We're seeing those numbers hover in the 400s for a couple of weeks now. And of course, we're still in the 2 or 2.5. We were there for a significant amount of time. But let's begin with Dr. Linton. I remember when we saw that huge, massive outbreak in Daegu, and the country was scrambling, especially the healthcare system was scrambling. There was a huge spike in the numbers. We didn't know how to deal with this. And of course, since then, lots of changes have been introduced. What are some of the changes that you've seen over the past year, maybe at your own hospital, and that's made it more easier for medical personnel to handle these outbreaks?
It's much more organized in the initial stages. We didn't know what to do. Fortunately, the Centers for Disease Control had some experience with the SARS outbreak. But now we have screening centers in front of the emergency room, in front of the outpatient. Everybody who is admitted to the hospital gets screened. Even family members, you're only allowed to visit your loved one in the hospital if you are screened for COVID. So it's much more thorough, a lot of precautions. And everybody coming into the hospital has to have a fever check and also has to fill out a form in case we have a sporadic person that with an outbreak and we need to follow up and look back at who they met with.
Right. And some of these changes, of course, may be temporary. And once the pandemic is over, I guess we can sort of retract them. But at the same time, we learn from all of our experiences. And some of these changes are for the good. So do you think some of these changes are for the better and they will lead to better systems?
Absolutely. It's a very painful experience for all of us. But we've learned a lot. And we still have a lot to learn. We don't have all the answers. I want to make that very clear to the listeners. But from the onset of this program, I'd like to say that Korea has done, the CDC of Korea have done a remarkable job. There are always, in hindsight, there are things that could have been done different.
Right.
But overall, we're still very adamant. And I think as time goes by, slowly we will turn the tide.
Speaking of hindsight, I remember when we had you on the show at the outbreak early last year, you, as well as many sort of colleagues in the medical profession, you were calling for a shutdown of the borders to China or to other countries as well. Of course, that did not really happen in extreme measures anyways. And we also tried to avoid an extreme lockdown we saw in different countries as well. In hindsight, which of those measures do you think should have been implemented?
It's hard to say, but at the initial stages, probably flights to China could have been canceled a little bit or more rigorous screening.
Flights coming in from China?
Coming in from China,
Right.
especially Wuhan. I don't want to blame everything on the Shincheonji group, but they had quite a few contacts actually from the Wuhan Shincheonji group and
Right.
Shincheonji within Korea. So there's a clear connection there. I think if we had held off, it wouldn't have gotten spiraled out of control initially. Again, that's looking back. And there are economic issues. You have to worry about the economy.
Right.
There are not just medical concerns, but there's a lot of other relations with China,
Right.
political, economic. So that's the only thing that I could really say is it's unfortunate that we were not more vigilant.
Like you say, this is definitely a connected economy globally, of course, and especially with one of our biggest neighbors being one of our biggest trading partners, it's really not that easy, is it? And I'd like to bring you into the conversation as well, Mi-kyung, in just a bit. We know that a lot of the foreign workers, and especially migrant workers, were also affected by this as well. So we do have a clip from Anand from Nepal, and he is talking about some of the difficulties living as a migrant during the pandemic. So let's take a listen.
Hi, my name is Anand. I'm a migrant worker in South Korea. As a matter of fact, I am not satisfied at all, that sometimes, I have heard people are saying, COVID-19 is, only because of, migrant people. But what I think is if there is COVID-19 in South Korea, then both migrant people and Korean people are, equally responsible for that. And mask also very, that shortage during that pandemic, mask is used, sanitizer is also used, must and to use. And mask was not easily available in shop. At my workplace, I was okay, and I'm still okay because my boss and colleagues are, very cooperative, and I work in a factory, so we are working very safely as usual. But someone says that they are facing many, many problems.
So we heard from Anand from Nepal talking about some of the difficulties in getting masks, and I imagine some difficulty in just getting information about this new pandemic and this new illness. Mi-kyung, does Anand's story kind of echo a lot of the stories that you heard from some of the foreign and migrant workers here?
Yeah, at the beginning, the shortage of masks was the biggest challenge for all of us.
Yes.
And at that time, the Korean government tried to cope with this situation with the publicly controlled distribution of the mask. So I remember that 1 year ago, I had to go and stand in a long line in front of the pharmacy to get my two
masks
of
on your
masks
designated
for this.
day. Yeah.
Yeah. And actually, in this situation, the foreigners and migrant workers are systemically excluded because the system was running based on the National Health Insurance System
Right.
computer network. And this insurance is available for only long-term stayer. And on the 20th of April, the National Health Insurance System didn't used anymore. But the undocumented migrant workers still excluded because you need an ID card when you get your mask. So, and this situation, trade unions, especially the trade unions representing the migrant workers, took actions. And migrant trade union in Seoul and Seongsa Industrial Area Trade Union in Daegu called kind of mask donation campaign
Right.
through the social media, and the response from the public, especially the religious community and the human rights community, was so enthusiastic. So they successfully gathered some 1,000 masks and they brought it to the factory area and they distributed it to the migrant workers directly.
That's great to hear. I mean, like you said, I think we had difficulty with securing masks, whether you're foreign or not initially in the beginning, but that a special effort was made to reach out to the foreign workers. It's great to hear. But in addition to the masks, there must have been a negative perception, especially when we saw the spike coming out from Itaewon and this kind of misconception, really, that foreigners were at the middle of this latest outbreak. Did you hear about any stories about dealing with that kind of misconception and any negative outcome from that?
Yeah. As we remember, the outbreak of the COVID-19 was come from China, and at the initial stage, the infection was concentrated in China as well. So at the time, people have misconception that Chinese people is a source of infection, and in case of the migrant workers from China, including Korean Chinese, even though they had never visited in their hometown for a long time while they are working here, there was a huge hate and discriminatory sentiment against these people, and they are mostly working in a restaurant or care sector and a construction site.
Did it lead to them losing their jobs then?
Yes, yes, really? It was the case.
And of course, it also led to various local governments, even to this day, mandating or strongly recommended sort of testing of foreign workers or foreign employees. I was wondering, Dr. Linton, does it make sense from a medical standpoint to have just the foreign workers or foreign employees tested? Is it helpful in curbing any outbreaks?
Medically, that is totally, it is not logical. I would like to say, though, that a lot of the foreign workers are living in very, very cramped conditions. And that obviously is conducive to passing the virus or any airborne, or fomite or dead object-borne disease. So, no, the foreign workers should not be the target, but those who are living in close quarters, we need to be more vigilant in watching them and testing them. So it would be pure discrimination to go after foreign workers. On the other hand, we do need to look at populations. And this is not just foreign workers. This is, the JoongAng ones.
Right.
And even for students that are in dormitories, it's a big issue. So it's a much wider range than... it's unfortunate that foreign workers were targeted.
It is unfortunate. It seems like it was a story that was repeated almost around the world where certain communities were kind of targeted for this when we saw some initial outbreaks. But with that said, we should try to move on to our next topic, which is, of course, the economy, and was hugely impacted by the COVID pandemic. So, Jim, let's start off by telling us just how badly was the economy affected?
Well, the economy is obviously a huge, huge subject, once again, which is covered by pretty much everything. The first hits we saw to the economy came from the international travel lockdowns. Restrictions began in January last year and are still largely in place today. The economic impacts of that are huge, not only to travel and tourism-related businesses, airlines. We've seen airlines shutting down in Korea, accommodation and tour operators, but also to import and export-led economies like Korea, multinational corporations like every single chaebol in Korea who are severely limited in their business operations. There's also a social cost. We've just talked about foreign workers and anybody who lives, across divided borders and are no longer able to reach their family. Migrant workers are often making money to send back to their own economies, and that injection is a huge part of those of how those economies operate, and that no longer happened. So the lockdown was the first big hit. In Korea, we've then seen a number of localized things. The introduction of the 9 p.m. dining rule last year, which was raised to 10 p.m. in February this year. It's too early to know exactly the economic cost that has. The numbers, don't exist yet, but we've all seen restaurants disappearing on the high street and bars shutting down in our local areas. Perhaps the impact hasn't been as bad as in other countries that went into a full lockdown, especially because Korea has such a robust takeout system in place.
Delivery.
Yeah, exactly. So the reduction in outdoor dining may have been less devastating than other countries, but that's relative. If you're not making any money in your restaurant, it feels just as devastating, regardless of what country you're in. We did see some relief. The Korean government has taken a pretty aggressive approach to fiscal relief programs, offering more or less a constant stream of relief funds to businesses and consumers pretty much since the pandemic began. The positive impact of this is very clear because relief funds come in the form of credit card credits or regional benefits, like in the Gyeonggi province vouchers. People were encouraged to spend more rather than in some countries, like in the US, where it was sort of just a check and people just put that into their bank account. They didn't necessarily put it back into the economy. But again, there's going to be a very, very long-term negative financial hangover from this, as in the future we're going to have to deal with a country committing a significant percentage of its GDP to relief funds. That's a bill that someone's going to have to pay one day.
Right. And it seems like those relief funds are going to continue to come in the coming year as well. It's already been allocated in the budget. I did want to ask you, Dr. Linton, when we first came up with these 9 and then 10 p.m. curfews, there were a lot of people, and I know some people in the restaurant business and in the sort of the food and beverage business, and they were complaining, it's not as if the virus only comes alive or it's transmissible in the evening time. So how effective is this measure? So they were very much complaining about this, and they were saying it's very discriminatory against their businesses from a medical perspective. Again, how effective was this 9 or 10 p.m. curfew?
I think it's ineffective because of the manner of, I have to be very careful here in the way I say it, but there is one thing that nobody has mentioned as far as I can tell, and that is the passing of glasses in drinking. That is, if you are a COVID patient or a patient that's incubating COVID, it's 술잔 돌리기, giving the glass back and forth. So late after, having a drink or two and late night things become more relaxed, then people tend to be less strict about their contact with each other. We had a group of professors at my university that, early along, where I think 9 were tested positive, and they had, this is before the restrictions, but they were all sitting down at the same restaurant, and obviously, how did all of them get, it's a case in point, how did all of them become infected? They must have been passing glasses. So in that sense, limiting the amount of time that you're having the party, let's say, and I don't want to be, I'm strictly being scientific in what I'm saying, it's humorous, but I think that may have been a good reason to limit people's time together. Right.
I think a lot of our sort of usual traditions of, just dipping our forks, the communal sort of dipping, that was kind of the tradition of dining in the Korean style, the passing of glasses. I would think a lot of those practices were sort of changed during the pandemic, and I think people have become much more aware of personal hygiene and the importance of that. But like you say, after a drink or 2 or 5, and the longer the night goes, people do tend to get more relaxed, and then we kind of let our social distancing down, I guess. In that respect, it may have definitely been effective as well. But like you said, Jim, it wasn't all negative. We definitely saw an uptick for several online, especially the delivery businesses as well. But at the same time, most, I would believe, and especially the smaller businesses, they took a huge hit. So why don't we hear from some of the business owners themselves, especially the small mom and pop stores?
제가 장사를 했었는데 스타트는 좋았어요.
I was running a business, and 5 months into it, the pandemic hit.
5개월 만에 코로나가 이제 터진 거예요. 70-80%가 줄었는데
Sales went down by 70 to 80%, but the hours I put in were still the same. I gave up after 18 months.
한 시작한 지 1년 반 만에 일단 장사는 접었죠.
커피숍을 했었거든요. 근데 이제 코로나 오면서 도저히 내 월세 감당이 안 돼가지고
I owned a coffee shop, but I had to close it down because I couldn't pay the monthly rent. I wasn't even able to get my deposit money back and still have a ton of debt.
다른 걸 또 하고 있습니다. 자영업하는 주변에 지인들이 많은데 그쪽 가서 이제
I get by doing part-time jobs at my friends' stores.
지금은 이제 알바가 더 좋아요.
They're envious of me. It's a strange world that we're living in.
희한한 세상이죠. 네.
Strange world indeed. I'm not sure if they really are envious. We definitely saw some businesses doing well, but generally not so good news. Right, Jim?
Yeah, and there's a big difference here between businesses that have a brick and mortar high street location. Yeah. Of course, the second person we heard from runs a coffee shop, which is such a major industry in Korea. There's quite literally a coffee shop on every corner and a couple in between as well. Other businesses which operate purely on delivery basis, we saw a huge boost in things like electronics, interior design, furniture, places that don't necessarily rely on an in-person location where you can just order online. Those industries might have done well, but the Korean high street, especially not your chicken shops and stuff that operate on a delivery basis, but companies that rely on people coming in the store, has been devastated and again, it's going to be in the next few years that we sort of see what that looks like once the dust settles.
And you mentioned it before, but a lot of these restaurants especially, they did go out of business with the restricted times and just people not dining out as much. And I know that a lot of the foreign workers are employed at restaurants as well. So that must have meant, in addition to the misconceptions and the sort of the negative perceptions of foreigners as well, just the lack of jobs. And that's why you talked about the employment permit system, and it's been criticizing for limiting the rights of migrant workers to kind of freely move about their workplaces. Has there been any sort of improvement or movement on this front?
Yeah, actually, during the pandemic, many migrant workers lost their jobs and was forced to take the unpaid leave or was given the furlough. But in many cases, for the local workers, they are supported or protected by the employment insurance system or job retention scheme, which was introduced by the government. But in many cases, migrant workers are working in a very small size workplaces, which this system was not applicable. But ironically, in the agricultural sector, the demand for the migrant workers are very high because they have to go for the harvest in time, or they face some kind of depression of the harvest. So the farmers who are hiring migrant workers are demanding the government to temporarily legalize the migrant workers. And at the same time, it is not related to the pandemic, but there was a tragic accident in an agricultural area when young women, migrant workers from Cambodia, died while she was sleeping in very poor conditions, dormitory. So at the end of this situation, last week, the parliament introduced a revision bill of the EPS system to extend the period of stay for the migrant workers without a job up to 1 year. And they also introduced a new ground of a change of workplaces, which is not applicable for the migrant workers.
So that is a step in hopefully the right direction as well, and improve more flexibility for the workers and also for the employers who need these migrant workers, of course, as well. All right, we're going to have to continue our discussion on TBS eFM COVID-19 special, a look back and forward in part 2. So we will be back after this very short break. So welcome back to part 2 of TBS eFM COVID-19 special, a look back and forward. I'm Na Seung-yeon, and I'm joined in the studio today by Dr. John Linton, professor at the Department of Family Medicine at Yonsei University and director of the International Healthcare Center at Severance Hospital. We're also joined by Mi-kyung, international director of the Korean Confederation of Trade Unions, and our third panelist is a familiar voice to many of our regular listeners, Bulley, senior editor at the Korea JoongAng Daily. Now, we've been discussing how the pandemic impacted various aspects of our lives. We looked at the major sort of COVID spikes, as well as how our economy was affected. Now, we also have to talk about the past year from a medical perspective, of course, like Korea's testing success. We were talking about K-quarantine, promoting that for a while as well, and also get an update on where we are with the vaccines. So, Jim, like you said before, we did get a lot of applause overseas even for our early success in containing the outbreaks. Let's talk about the medical front.
Yeah, I'm going to just talk briefly about the medical front because I'm very aware that Dr. Linton's sitting here listening to me screw it up. But you mentioned the early success. We've already talked about this a lot as well. But there's kind of two stages to the international perception of Korea's handling of the COVID-19 pandemic. There's the very, very long early success. Korea very quickly stood out globally for the success of its quarantine measures, the success of its test and trace system, and the success of its test kits. And Korea's bio industry quickly adapted to manufacture test kits and export them around the world. And that was a huge, huge success story. as was Korean masks. That was kind of the second wave of Korea's medical rollout success. We talked earlier about the delays right at the beginning in trying to get masks, but that really didn't last long compared to most countries. Koreans, as a society, we also did not struggle to adapt to wearing masks. It's something that we're already fairly familiar with. There wasn't that issue that you've seen in Europe and a lot of other countries. And there's a lot of masks available, including dental masks if you need them, the KF-AD masks that were introduced for the summer. These are now fairly easy to reach, and we never had to deal with that sort of homemade mask phenomenon that is still very common in a lot of other countries. The other side of kind of the medical news then is the slower rollout of vaccines. That's kind of when the news flipped and it became less celebrating Korea's success and more concerns that Korea has approached vaccine acquisition and the rollout for vaccines, which started here on February 26th. As of last week, about 1.4% of the population had been vaccinated, at least with their first vaccine. So that's kind of been a bit of a slower process after that early success.
At the beginning, as we mentioned, we were promoting K-quarantine. I remember that I think the government and also health authorities, they were promoting Korea's sort of model of 3T, which was test, trace, and then also treat. And those 3 T's were heavily promoted as our sort of success formula for K-quarantine. Dr. Linton, this 3T, I haven't seen it being promoted as much, and it is very time costing and also cost-wise itself, it is very lengthy. Do you think it's still a viable way of containing these outbreaks? We've seen the level of sort of untraceable cases go up as well. Or is it something that only worked in the beginning when the number of cases itself was quite low?
That's a very good question. I would say that obviously our testing ability from the very beginning was much faster than the United States, for example. And that is remarkable and is praiseworthy. Now, you could make an argument now that 1/4 approximately of the cases, 25%, are untraceable. So, people that are, would be negative on that point would say, what's the point of following up everybody? That also is erroneous. In my own clinic, we had, several months ago, we had a nurse that tested positive. And our entire 50 people working with our clinic, directly or indirectly, were tested. I was tested. And 12 people that were in close contact with the nurse were put into quarantine for 14 days. And it worked very nicely, very smoothly. And we could get back to work in an orderly manner. So I would say with a strong yes that tracing and quarantining people is the right medical, scientific way to approach it. So it is true that 25% are very difficult because there are scattered clusters out there that we're not going to know about, we're not going to be able to find out. That's a reality, but that is not an argument that you should not be aggressive in testing and screening and isolating people. Very important.
It's still just 25%. If it was maybe 50 or more than half of the cases were untraceable, that might be a different idea or might require a different approach. But when it's 25%, like you say, the benefits outweigh.
I couldn't have said it better.
I was curious, though, to toss it back to you, Mi-kyung, when they had these mandates and some provinces, local governments still have these mandates for foreign workers to get tested. Is it actually easy for the foreign workers to get tested, whether it's because it's highly recommended or whether it's mandated or not? Because we also saw, as the long lines with masks, we also saw some long lines for foreign workers trying to get tested. And sometimes they have to do it after their work is done. And again, that leads to crowding. It almost seems like those lines itself might be a risk for catching the virus itself. So how has the situation been for foreign workers who are trying to get tested?
In our information, around 8 metropolitan cities or provincial governments introduced this mandatory testing for the foreigners and foreign workers. And this was accompanied by some kind of heavy sanction, like penalty in case of those who failed to get tested or the ban on not hiring migrant workers who doesn't have the results of the test. So many migrant workers told us that their employers forced them to be tested. In some cases, the employers threatened the migrant workers to get tested. If you don't go to the test site, you will be fired. So in this very threatening situation, the migrant workers have to go and get tested.
Right. I mean, the employers themselves, I believe, the enterprises, they were also threatened kind of in a way with penalties and fines if they do not have their employees tested. So in a way, it just kind of comes from the top down. But I know that there were a lot of negative perceptions by the foreign workers themselves because we have a variety of foreign workers and them being subjected to this sort of mandatory or blanket recommended testing did sort of get their ire up and they were quite angered by this. We do have a clip of some foreigners' response to this sort of testing. So let's hear that first.
Koreans early on dealt with that. I didn't really feel marginalized or stigmatized until recently when many foreigners were asked to get tested for COVID. I'm still not even quite clear on it. Like foreigners that had jobs at schools and such were asked to get tested, and it really felt quite discriminatory.
Oh, I mean, it was massively racist and xenophobic towards foreign workers, in particular, like immigrant workers from India and foreign countries also in Asia were in particular like dire straits about it because it was directly targeted at them. But I'm glad they reversed it.
Only in Seoul. It's still going on.
Yeah, it's still going on in those places.
So it seems like there's still a little bit of confusion even amongst the foreign community about whether it is mandated or not. But from those two clips anyways, they did regard it as discriminatory and basically racist and maybe stoking xenophobia as well. I wanted to ask you, Jim, because when, of course, last year around this time, you, I believe, were traveling around the world. You had been saving up for this big travel around the world, and of course, that was cut short by COVID-19. But you had firsthand experience of maybe comparing different countries' response to this outbreak. And so from that perspective, what was your sort of experience maybe concerning like an Asian person, your wife being Korean as well? And I know you had some experiences with that as well. So tell us a little about your experience on the road.
Yeah, absolutely. I reported every painful minute of it here on Life Abroad at the time. I traveled through 9 different countries as like the walls sort of started slamming down. And I can't speak highly enough about K-quarantine as kind of a phenomenon. Since COVID-19 was declared a pandemic in the middle of March last year, since countries started closing their borders, I traveled through Mexico, Costa Rica, Cuba, the US, the UK, and then Korea. And Korea was the only one where my temperature was taken at the border. Korea was the only one that required any kind of quarantine treatment. Korea was the only one that required a detailed history of where you traveled and stuff. And this was after countries like the US had closed their borders to Europe. This was after. This wasn't because Korea was the only one that had a big issue yet. It was just because Korea was the only one that was on the ball. In terms of the reception that we faced around the world, I was in New Zealand in January and early February when the story around the world was China and Korea.
Right.
And there were stories about people of Asian heritage being attacked or abused, even within New Zealand, which we tend to think of as the nicest country in the world.
Not Canada? Okay.
Or maybe they're both up there. We were held, entering the Cook Islands. We were held at the border because my wife looks Asian. And even after I said, hang on, if you're stopping her, you've got to stop me because we're both, citizens of Korea. They weren't interested. They only took her. We encountered things like that at a few different borders, but we were never, even for countries, we entered Costa Rica after it closed the border to Korea. But even after countries, once they find out that you haven't actually been from there, we didn't face a huge issue. But there was definitely some xenophobic response. And Korea has just got this so right in terms of the quarantine measures that as a long-term foreign resident of Korea, these measures that came out from the Seoul government and the Gyeonggi government, they definitely were ill-advised, and they don't seem to have any sort of medical basis. They seem to have been a knee-jerk reaction. Right. And as we're now finding out from Korea's own human rights monitoring body, they probably were discriminatory as well. But that seems to be one major misstep in what is overall a success story. And as a foreign resident, had I had to, I would have gone and got tested, and I might, it might have been a bit annoying, but I probably would have felt safer overall for it.
Right. Like you said, though, and as we heard from the interviewees who are one American and one British employee, I think what they faced and their situation could be quite different from that of a migrant worker or maybe a foreign worker as well. And the sort of xenophobia or the sort of environment that they are placed in on a daily basis can be very different. So the experience can be different. So let's hear a clip from some of the difficulties faced by Rashid, a foreign worker from Bangladesh. So let's cue that now.
저는 방글라데시에서 온 라시드라고 합니다.
I'm Rashid from Bangladesh. Living in Korea during the pandemic has been really difficult.
파격하면 코로나 걸리면 어떻게?
My employer tells me to order things from the internet and not go out because I might get the virus.
시키면 되잖아. 아니면 인터넷으로 사면 되잖아. 이런 말이 또 늘었습니다. 며칠 전에 코로나 검사를
I had to get tested for COVID-19, but shouldn't Koreans be tested too?
한국 사람들이 검사 안 해도 돼요? 외국인 분들이 바이러스 아니잖아요.
Foreigners are not viruses. This is discrimination.
이것도 사별이라고 생각합니다.
So Rashid talking about, 외국인이 바이러스가 아니잖아요. And I think that's a message that's been echoed around the world. And we've seen these sort of targeted attacks against certain communities around the world. It's not just here in Korea. Mi-kyung, do you have anything to add to that? Again, is this, I guess, a common sort of experience by many migrant workers?
Yeah, actually, during the discussion about the mandatory test was developed, I found some different kind of discrimination because when the Jeolla province and Daegu city introduced this mandatory system, there was a big criticism from the migrant workers themselves, but this was not heard by the Korean society. But when the Seoul metropolitan cities introduced this mandatory testing system, a lot of criticism came out, not only from the migrant workers, but also from British Embassy or European Chamber of Commerce.
Right.
So after this criticism, the Seoul Metropolitan City government changed their policy from mandatory to recommendation, and the National Human Rights Council also delivered a recommendation as well. So many migrant workers felt like that when we raised our voices, this was not heard. But when the Western society raised their voices, it was heard by the Korean authority.
Right. And they do seem to be much more vocal and using their voice on social media and whatnot to get their voices heard as well. Yes, Dr. Linton.
I think of course, the way it was packaged and the way it was done was very unfortunate. It was not thought out. However, I think there is a way to do it for people that are living in crowded circumstance. I think there could be, maybe not mandatory, but voluntary testing, and perhaps even for Gyeonggi and Seoul, some type of incentive. If you come to test, we will give you, some type of it could be food or could be something to make it more pleasant. We encourage you to be tested. Generally speaking, the Korean people as a whole, there's a lot of noise over COVID. But at the end of the day, what I've noticed is the Korean people, and I think foreigners working here are the same, are going to cooperate with the government. Right. So we should have approached it more as a recommendation rather than mandatory makes everybody upset. I think there are better ways to implement and get the job done, because I don't think we should totally back away from crowded facilities. I think we should figure out ways so that we can test people that are at high risk, and it helps us all.
Because we need to focus on the goal, and the goal is to get people at high-risk facilities tested. And if it becomes recommended, and maybe with an incentive as well, that will probably get more people to get tested, come forward and get tested at a faster rate as well. We can't go on to our next item, I think, and we can't close up the medical segment without talking about vaccinations, and that is where a lot of our hope lies. As Jim said, right now we're about 1.4% as of last week anyways. Seems to be quite slow, the progress, for a nation that is used to pali, everything being done yesterday instead of tomorrow. What can we do to speed up the vaccination efforts, Doctor?
there was some delay in procuring the vaccines.
Right.
AstraZeneca is being produced within Korea. So I think this is taking time and people are frustrated. The important thing is getting 60% of the population vaccinated. This is going to take realistically until it's going to happen by probably late summer.
Mm-hmm.
I think there has been some delay, but I think the gears are starting to move.
Okay.
And Korea does have all the public health facilities. The U.S. did a very poor job because they had the vaccine, but they didn't have the mechanism to implement the vaccination. Korea has the, shall we say, the infrastructure of people, the public health offices, all of that throughout the country. So I'm cautiously optimistic that this thing is going to be speeded up in the next months. And by late summer, we will have hopefully over half and even better over 60%. But at the same time, there are some unknowns, and that is maybe I'm jumping ahead, but that is the UK strain, South African strain, and perhaps a strain out of Brazil. There may be other strains, and we don't have the data yet. Some of the data is looking encouraging that our vaccines are going to work against it. Some data is not so clear. But I think we just need to move a little bit faster, that's all.
Because when it comes to the mutations and the variants, there's no way we can stop that. But the only way that we can slow it down and its impact on us is by getting vaccinated as soon as possible, continuing our social distancing. And that, I think, is our cue to go on to our last sort of key word, and that is contactless or untacked, as we say here in Korea. Jim?
Yeah, untacked. I guess this is sort of the... I don't want to say the silver lining of the pandemic, but this is some progress that that it has pushed along, right? Huge, shocking events that affect humanity do cause innovation as well. Untacked, a portmanteau of the prefix un and contact, kind of the Korean word for contactless or non-contact, but a little bit more graceful, I think. The rest of the world needs to get on board. Over the last year, we've seen a rapid increase in untacked services. This was all happening anyway. But the COVID-19 pandemic has hugely increased this. Obviously, we're all familiar with going into restaurants and cafes and using an electronic kiosk to order your food. We're familiar with ordering food or even drinks, coffee, whatever, from our phones using apps. The government's QR code system is an untacked tracing method. We have untacked thermometers now. I mean, when we walked into this building today, you just sort of stare and it tells you what your temperature is. Just last week, TBS reported untacked breathalyzers whilst that the police are using sort of like a selfie stick to stop drink driving. All of these different untacked systems are becoming increasingly common. We see unmanned banks opening in Korea, unmanned phone shops.
Ice cream stores. This
is all innovation. We have stores where you scan your phone on the way in and you go and just pick up whatever you want and it charges you on the way out. Those convenience stores exist. There is a downside as well. These kind of services can definitely isolate older users or people less familiar with the technology, people who can't speak Korean perhaps, people with some sort of impairment that limits their ability to interact with a screen. But on the whole, this is technological innovation driven by the pandemic.
If you are a computer phobe or a technophobe like myself, it is not that easy. For all the progress and all the necessity for untacked services and products, I have to say I have also struggled as well. So I know that I'm not alone. Mi-kyung, what do you think for especially foreign migrant workers? Like you say, if you're maybe not familiar with the technology, that's one thing. But if you don't have the language service in maybe English or a different language as well, it must be very difficult. Or actually, do they actually prefer it in a way as well? What's the situation been like for foreign workers?
Well, actually, I have never talked about this situation with foreign workers. But I guess if the services are provided by different languages, including their own languages, it could be good for them to use. But there are many limitations in terms of the information and services, which is mainly provided by the Korean or English. And in case the migrant workers are not familiar with these languages, they might have some difficulties.
Because a lot of these unmanned kiosks or stores, you must have a credit card or something like that, or a debit card. And I'm not sure that all foreign workers or migrant workers would be easily able to access one or get one as well. So that must sort of limit their access to these untacked or unmanned services. Now, I know that hospitals, I've been to a couple of hospitals myself, and so they have introduced several of these sort of unmanned or contactless systems as well. What has been implemented in your hospital, and do you think that'll be continued going forward?
Well, for the younger generation, these computer or cell phone devices of untact are very practical. I think, but we've got to go also make room for like elderly people that don't know how to use them. I think very simple things like using hand cleanser before you pick up the pen and start writing. That's very, very sound in preventing transmission. So I think the untact technology is a great thing and it should be used, but there also should be a way to do the paper way and do that safely.
Mm-hmm. I know my mother, I've just really introduced her to maybe 2 or 3 technologies provided by the nation's sort of major messenger service. And she was very proud with that. Getting her on board with so many of these other untaxed services will be another challenge, but hopefully we can get there as well.
As a joke, we say that we have BC and AC in the hospital. As 2,000 years ago, BC and AC, but now we're talking about before Corona and after Corona. So all these devices. And I also would like to point out one other thing that we see this year I've seen 0 influenza cases.
Yes, that is a silver lining indeed.
So there are some good things that have happened. The common cold is unheard of anymore because of social distancing. So it's not all bad. I think society is changing. A lot of things are changing, and we need to change to adjust to this new environment.
And I think that's a great segue, actually, as we need to wrap up our discussion. I would like to ask all of our guests, what is the one thing that you are most looking forward to, AC, post-COVID, when we can finally, say that, okay, we are done with the worst of the pandemic? What are each of you looking forward to the most? Jim?
I mean, it's just life, isn't it? Not, being able to travel, being able to see friends and family, not having to shortlist whoever you want to have dinner with down to 3 people every single time, being able to return to some sort of normalcy. And I'm very aware saying that we haven't really been affected as much as most of the world.
Right.
Most of my friends and family in the UK are still or have been in like heavy lockdowns and stuff. But that is still, I think, what everyone wants, right? Is just to go back.
Okay. Miss Yu?
I miss free midnight because actually during the pandemic, I don't have to travel abroad to attend a meeting, but instead I have to attend a meeting virtually.
Online meetings, I see.
We are isolated time zone, so the meeting time for me is always midnight.
Midnight meetings.
Early in the morning.
Okay, so maybe return to more normal hours as well. You don't mind the offline meetings if they're back to normal hours. Dr. Linton?
It's going to sound very strange from a doctor, but frankly, I'd like to get rid of the mask so I can see people's expressions.
That. Yes.
Because a lot of communication is body language, and you don't know what people are thinking when you look at their mask. It'd be very nice to go without a mask in the future.
That would be my answer as well. Just the ability to see people's faces in their entirety once again. And when we go out, to breathe in the fresh air without this layer of plastic or cloth between us. I think that's what we're looking forward to. And I want to thank all of our guests once again, Dr. Linton, Miss Yu, and Jim, for taking part in our discussion. We are going to end TBS eFM's COVID-19 special, a look back and forward. The show is going to air again on Sunday, April 4th from 9 to 10. So please tune in again if you'd like to catch some parts that you might have missed. Now, we hope that this has been a valuable opportunity for us to take a look back at the past year of living with the pandemic and also what we can look forward to in the coming months as we move closer to a world, without masks. Our show is produced by Christina Seo with writing by Jennifer Chang and Mi-kyung, and I'm Mi-kyung. We're now going to hand it over to Uncoded with Uncode.
Being able to go on a plane without having to worry about the process of coming back in, and also seeing more than 4 or 5 people at a time.
Really see people come together. The pandemic has sowed a lot of division, and it'd be great to just have people share meals together and love each other.
우리 좀만 다 같이 버티면은 상황이 금방 종식될 것 같으니까 놀고 싶은 마음 잠시만 넣어두고 좀만 참으면 언젠가는 다 같이 놀 수 있는 날이 오지 않을까.